Hi everybody out there, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan. I want to talk a little bit about bleeding gums today. Bleeding gums are never normal. It's never normal to have bleeding gums. You think, well, everybody's gums bleed when they floss sometimes or they brush sometimes. No, your gums shouldn't bleed. They only bleed if they're not healthy. That means you have an infection or inflammation that's causing those gums to bleed. So bleeding gums are never normal. Sometimes you can improve them at home, which we can tell you a little bit more about. So gum disease, of course, is the number one cause, or periodontal disease is the number one cause of bleeding gums. Now, some people have certain systemic diseases, for instance, leukemia. I've seen cases of leukemia where the gums do tend to bleed much more easily. Certain kinds of cancers possibly might increase the tendency for bleeding gums. But the main cause, 99 point whatever percentage of the time, is infection in the gums that you don't feel, that you don't see, that you don't even know is there, but causing a chronic inflammation, the bleeding, the infection, which then leads to bone loss and possibly eventually tooth loss, as well as compromising your general health. Bleeding gums have to be stopped.
Hello, my name is Amar Katranji. I'm a periodontist here in Southfield, Michigan. Today I want to talk a little bit about bleeding gums and what you can do at home to help treat them. A lot of people ask, I notice a lot more bleeding when I'm brushing and flossing. A lot of times what you're seeing is more plaque is creating swelling around the gum tissue. You really have to do a good job of removing the plaque in between your teeth and especially the stuff that's between your gums. The first thing that you have to do is you have to do a really good job at home with your home care. So brushing and flossing is critical, and doing it properly is critical to eliminating the inflammation that causes the bleeding in your gums. So good brushing habits, good flossing habits is the first place you can start. Now you can also use stuff at home like salt and baking soda. If you mix that up, you can either put a little bit of a concoction right on a toothbrush and brush it around your teeth and your gums. That can help reduce the swelling that you have around your gums, and that can also reduce the bleeding that you'll see. Another thing that you can use is hydrogen peroxide and rinses with hydrogen peroxide. What that does is it increases the amount of oxygen in your mouth and helps reduce the overall swelling that you have. So that's another option that you can do at home. And finally, what we really like to see is if you continue to see these things, coming in and seeing a periodontist to help treat you professionally if you continue to see the bleeding.
So you may be able to treat your bleeding gums at home. That's possible, but sometimes that can't be done, or if you can't do it, we treat it here. And how do we treat it? Well, we take a slide, we take a sample from under your gum to see what organisms are there, to see the parasites, to see the bacteria that are contributing or causing the bleeding gums. We then eliminate those. Our treatment eliminates those bacteria. When we eliminate those organisms, the gum bleeding, the inflammation stops, the bleeding stops. Your mouth gets healthier and your body gets healthier. Because if I told you all of the systemic diseases, the general diseases that are increased by having gum disease, you would be amazed. I call it the other silent killer. And the goal is to eliminate all bleeding. If you can do it with your home care, great. If not, that's what we do here. Our goal is to eliminate all infection and never have any bleeding gums, which is a cardinal sign of gum disease. So, have a healthy mouth, you'll have a healthier body, and have a great day.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com to schedule your appointment today.